Good afternoon. Welcome to today's webinar on non-standard hours. This is Brenda Zedlitz. I'm Senior Director of Partner Success, and we are so happy that today we're going to share the impact of parent working non-standard hours on child care programs. Thank you all for taking time out of your day to attend. At Child Care Aware of America, our vision is that every family in the United States has access to a high-quality, affordable child care system that supports children's growth, development, and educational advancement and creates positive economic impact for families and communities. So this is truly a very timely webinar. We just have a couple of housekeeping items that we want to share before we jump right into the presentation. You'll see on the screen our fabulous welcome. We are dedicated to helping CCR&Rs become the best known and the trusted child care resource in their communities. So welcome to this national community of experts and practitioners. We are delighted that you're here today. First, if you have any questions throughout the presentation, please enter those into the chat box and we will direct those accordingly. We're going to reserve your questions to the end, and we will follow up with the questions afterwards if we don't get to them during the presentation. We're packed full with high quality content and very robust resources and information today. So don't despair, we will get to your questions. Second, this webinar is recorded and will be available on our YouTube channel tomorrow. The link is going to be provided via email. And something that's really cool, members have already received an embargoed report entitled, "It's About Time, Parents Who Work Non-Standard Hours Face Child Care Challenges." This was sent out. Please do not share until the embargo is lifted tomorrow at 11 a.m. Eastern Time. The link that you were provided will take you to the final report after 11 a.m. Eastern Time tomorrow. Also, there are handouts available for download in the chat box, so please avail yourself of those. And it's my pleasure to introduce to you Sarah Diamond, our Partner Success Director, who is going to facilitate for us today. So Sarah, welcome.
Thank you so much, Brenda. It's good to be here today. And as Brenda said, we have a great lineup of speakers who will be participating with us. We plan to introduce them to you throughout the webinar. So let's take a look at the agenda. Today we're going to discuss the issue of non-standard hours in childcare and proposed solutions. We will learn from a few special guest speakers about the ways they have supported families who need care during non-standard hours. We'll spend a few minutes thinking about the childcare resource and referral landscape and policy recommendations and the actions you can take to address the challenges around non-standard hours in your communities. This presentation will wrap up with a sneak peek at upcoming projects that our research team is putting together and helping to address the questions that arise. To begin, I'd like to introduce our first speaker. Dr. Deon Dobbins is Senior Director of Research at Child Care Aware of America. She has over 15 years of research, evaluation, and technical assistance experience related to the well-being and stability of children and families placed at risk. In her work at Child Care Aware of America, she leads a team of researchers on such reports as this one and our annual cost of care report. Dr. Dobbins will be talking with us today about the issue of non-standard hours in childcare and proposed solutions.
Thanks so much, Sarah. Good afternoon, everyone. And if you're in the on the West Coast, it's probably not morning yet. But I'm so pleased to afternoon yet. I'm so pleased to share our latest report with you. It's about time. Parents working non-standard hours face child care challenges. Listen, we at Child Care Aware of America have been hearing about this issue for a while, and we think it's about time for our country to pay attention to this critical issue. And you know from our portfolio of work that we're concerned with working families and the challenges they face finding quality, affordable child care for their children and accessing it. And that struggle is not new, But we're seeing a societal shift that's adding to that challenge, and then that's that fewer Americans are working standard schedules, you know, that traditional 9 to 5, Monday through Friday, 8-hour workday, 40-hour work week. More people are working non-standard hours, and the current child care system is failing them, and it's not able to accommodate their needs. So we wanted to shine a spotlight on the issue and share why it's a problem and share some solutions with you that we've heard from the field. Some of them from members like you, and so we're really excited to introduce you to them. But before I go too far, I want to define what we mean by non-standard hours, because there's not one standard definition in the literature. There's a variety of terms in the literature to describe non-standard hours, and for some folks actually talk about non-traditional hours, and they're used interchangeably. But it can include irregular schedules, schedules that change from day to day or week to week, childcare that is happening during the weekend and overnight care, extended hours, drop-in care, or emergency childcare. But for the purposes of this webinar, we'll refer to it as non-standard hours. Why do we need non-standard hours childcare? Well, as we mentioned, parents are working those schedules, and they face limited options for center-based childcare that's open during non-standard hours. And many families are cobbling together multiple childcare options, including center-based care, home-based care, and family childcare. And some are using childcare that's provided by family, friends, and neighbors, also called FFN. This approach of trying to struggle to find the different providers to take care of our children strains both the parents and the children who lack a consistent child caregiver, and they lack consistency in their schedules. We know that 43% of all children under the age of 18 have at least one parent who are working non-standard hours, and we calculate that to be about 30 million kids. We know that many companies are expecting coworkers to work on demand, and that means parents need more than what we quote call daycare. Of course, we know that child care is important, but they need more care during all hours of the day. Also, we know that non-standard hours child care is relevant based on the current child care legislation from the CCDBG law, the federal program that funds child care subsidies and quality initiatives at the state level. The law highlights the importance of addressing all the employment circumstances that families who receive child care assistance face, and that includes parents who are trying to work non-standard hours and need care. The law also stresses that quality standards apply for all children, no matter where it occurs, even during non-standard hours. So states are required to measure supply and demand for certain populations, and one area that they're required to look at it for is child care during non-standard hours. There are some concerns with child care during non-standard hours. As we mentioned, like most child care, its supply is inadequate, but it's even more so with non-standard hours. The demand is high among some working families, and it disproportionately affects the most vulnerable populations. And because of its limited supply, it can be unaffordable, and it's often unregulated. And of course, quality is uncertain. And some research points to the negative outcomes for children who are in these situations. We know that about 40%, that non-standard hours workers earn about 75% less than other workers in the United States, and they're less likely to receive benefits or paid time off. One industry that we highlighted in our report was restaurant workers, and most of them are tipped, so you know they have a very low base salary. In order to make more money, they work nights, and unfortunately, that's a time when it's really hard to find quality licensed child care. A report by the National Women's Law Center and the Restaurant Opportunity Center United found that nearly half of mothers working in the restaurant industry were reprimanded for their work due to difficulties in arranging child care. The lack of non-standard child care affects certain populations more. Parents with low income, they're less likely to have family-friendly benefits. Low wages make it unaffordable to find child care. They lack paid leave. They have irregular schedules. Single parents have no backup. If you have two parents family or two people taking care of your children, you can often switch up schedules. But if you're a single parent, it's extremely difficult and especially if you don't have family or backup. Minority families are overrepresented in the non-standard hour workforce, and African American and Hispanic parents are more likely to be in the non-standard hour workforce. For instance, at age 29, African American mothers are 60% more likely to work outside of the typical daytime hours than within their whiter Asian counterparts. And 75% of Hispanic children with working parents have at least one parent who works non-standard hours. So we know also that students are a concern, a population of concern. 1 in 4 parents who are students live below the federal poverty line, and they struggle to balance work and school and family while they're pursuing their education. They have extremely limited child care options, and they're typically relying on the university campuses, which have large wait lists, and the funding sources that supply child care for them have long waiting lists, and there aren't enough. We also know that the demand is high, but the supply is low. So only 8% of center-based programs are providing child care during the non-standard hours. That's according to the National Survey of Early Care and Education. And we know that family child care providers deliver the bulk of that child care, but it's not equally divided. We know that most of those family child care providers who are doing that non-standard care are unpaid and unregulated. So we just don't know a lot about the quality of what's happening in those areas. And to make the problem even more critical, many families' child care leaders are leaving the child care system in an alarming rate. Change the slide. So we know that there's a number of solutions. We highlight a lot of them in our report. I don't want to go through all of them, but in general, I'll just briefly share with you. We talk a little bit about how communities and states are looking at passing laws to promote predictable schedules for employees, letting them have advance notice, and having some input on their schedules. As the early childhood education community has done for years, states have started to think about how they could coordinate programs and funding sources to pull together offerings that are more substantial and flexible with odd hours and more coverage for families. We have quite a few examples in the paper about the importance of the business community in this space. They are investing in centers, investing in supporting quality efforts for all providers. They realize that it hurts their bottom line to not have workers that can avail of non-standard hours childcare. If you know anything about some of our work around mapping, you would know that we do have a specific map on our Mapping the Gap work that shows that from the state of Massachusetts, where we looked at the supply of licensed childcare around casinos during the non-standard hours time frame. And what advocates have done with those maps is use them to help them make the case for more non-standard hours options in those areas. Certain communities, like the military, are especially in need of non-standard hours. Our organization itself helps National Guard and Reserve families find quality care during drill weekends. And one of our guests today is going to share an example of how they're doing that in Delaware. And also, our other guests will talk today about some of the other issues or proposed solutions that we found, including how we can collect data on non-standard hours to identify where resources need to happen and where they need to be spent, and how to support quality initiatives among providers who do childcare during non-standard hours. I'm going to turn the session back over to Sarah, who will introduce our next guest partner. Thank you.
Thanks so much, Dion. Yeah, it's helpful for us to think about how to define that challenge of non-standard care, especially across different sectors. We're really pleased to have Julie Johnson here with us today. Julie is the owner of Tender Loving Care Child Care and Learning Centers in Delaware, and she's going to share more information about the Little Heroes program, which is Delaware's drill weekend child care project, and share more about how they support members of the Guard and Reserves who need childcare during drill weekends. So Julie, welcome.
Well, thanks for having me. I appreciate having an opportunity to talk about our project that we've had here in Delaware. Just a little bit of background with regard to Delaware Little Heroes Drill Weekend Childcare Project. It was established in July of 2013, and we provide childcare on drill weekends for Guard and Reserve members. So approximately 1,000 Guard and Reserve service members in Delaware attend drill weekends, and this is referred to as the unit training assemblies, and it's held on the first weekend of every month. The training takes place on a full day on Saturday and a full day on Sunday. So the initial project implementation, one of the things that we started was the Delaware National Guard Youth Coordinator surveyed the Guard and Reserve families to determine the parents' level of need and the location for need. And then based on the survey responses, it indicated that finding non-traditional hours of childcare was often a barrier for Guard and Reserve service members to complete the required drill responsibilities. So as part of that needs assessment, it was critical in determining the best location for drill weekend childcare. And based off of that, that's where they came up with a location, which is currently in the northern part of our state, in the county called Newcastle County. There were a lot of community partners involved in the beginning pilot project, which includes the Delaware Department of Education, Head Start Collaboration, University of Delaware Cooperative Extension, Delaware Technical and Community College, Teach Early Childhood Delaware, the Early Childhood Council in Delaware, Delaware Joining Forces, and United Way, along with my program, Tender Living Care. So what we do is we identified the need. We talked about the barriers that there are and set up hours that based on the requirements for the service members to attend drill. And we are open on those Saturday and Sunday, that 1 week in a month, from 6 a.m. to 6 p.m. for those members to bring their children. We do serve children from infant all the way up through school age, 14 years old. We serve children with special needs. As well as part of that, it's whoever needs it, it's open to. One of the things that we wanted to make sure we included that breakfast, lunch, and snack, so that parents aren't having to worry about those items as well on the Saturday and Sunday. It was to try to meet the need and reduce the stress that they have with getting to the responsibilities of that drill weekend that they have to do. We did set a nominal registration fee of $20 per weekend for up to two children and $30 per weekend for 3 or more children. That is all the parents pay. Everything else is funded through private and public partnerships. If you can move to the next slide, please. So some of the lessons learned as we have worked over this program the last 6 years is making sure you determine the need for drill childcare project is an important first step in the process. So doing a needs assessment really gave us information about the number of families needing it, the location, the ages, and that helped set the budget and scale the project based on the needs that we have. The next thing is you want to be intentional when creating committee to develop an implementation plan. So you want to have invested stakeholders who will contribute to the long-term stability of the project. So engaging non-traditional partners such as institutes of higher education, Head Start, and community leaders resulted in comprehensive and creative thinking to support the project. So we're coming up with a variety of ideas from a variety of individuals. Explore funding sources beyond the usual early education public-private partners. The business community can be an untapped resource for funding. We find that a lot of them have military families as a priority. So this was something that fit nicely into their strategic philanthropy opportunities. And then you also want to make sure you're developing regular reports for accountability and transparency of the project. Making sure that State Department contracts are carefully executed and deliverables are met in a timely manner. So that way you can give feedback to your investors in it. And then making sure that you do evaluate the project and the necessary to make improvements for the service provided. That's a big part of going back and making sure that you're meeting the need and any other ways that you can improve the overall program. You can move to the next slide. So some of the project outcomes that we saw are across multiple individuals who are touched by this. So for parents, Little Heroes Drill Weekend Childcare allows guard and reserve families to focus on their drill responsibilities without the distraction of inadequate care for their children. So that was a huge thing for the parents. We also developed for early childhood education students as a partnership so that we are open on the weekends, and many of the early education students who are attending Del Tech Community College studying early education have difficulty getting into programs to do observations or required hours in order to meet the requirements of the classes. So one of the things that we did is we opened that up to those students on the weekends so they're able to come in on non-traditional hours and get some of that training and observation time. For children, one of the big benefits that we saw was the camaraderie between the children. So we generally have the same children every weekend, and these children have developed relationships with others. They have developed relationships with the staff, because typically it's the same staff that serve on every drill weekend. And they're able to interact with military children from other families who are in their same situation. And that doesn't always happen where they attend school or other places that they are at during the week. And we found that this really provides a social and emotional support for those children. The next part is for the Child Care Center staff. That's probably one of the things too. As I said, we have staff that are the same staff every weekend, and they have felt that this is an opportunity for them to give back to their military families. They do get paid for their time, of course, but at the same time, they're working 5 days a week, and then they go in and work all day Saturday and all day Sunday that week. And that is one of the things that they have just really, really kept them coming back, is the fact that they've developed a relationship with these children and they feel like they're giving back to the community. So based on the community as well, so one of the things that we've done is we've engaged state elected officials and leadership in the early learning community and really heightened the awareness of the needs of military families in Delaware. The sustainability is one of the things that we want to make sure that we can continue to provide this. So we've worked with community organizations, state government, and the early learning community, and they're very closely linked, which helps really is the collaboration process for that. We actually had written in budget epilogue some funding that is annually provided to support this program, and that's an important piece too for that. And next slide. So success and future of the program. So one of the things that we want to do is keep this almost free. So keep it very limited cost and continue to develop the strong relationships with groups in each month. We want to make sure that we're still engaging multiple partners, and we continue to give reports and talk about the benefits of this. The Early Childhood Council also is really supporting the program, and then we've also involved United Way, where donations can be made to United Way that then go directly to support the program for military families. I think really the crux of this is having the ability to work with partners, and there's a willingness to collaborate and a statewide mutual desire to assist military families. So it's coming from that driving force. We are committed to funding another location downstate, what we consider our downstate county. And we currently have a survey going out to existing families as well as those potential families that might be in need of this type of same drill weekend opportunity downstate. So we are definitely looking to expand the program.
Wow, Julie, this is really exciting. So this is Sarah. I just was commenting on how exciting this is, and it's helpful to hear how you identified the needs and some of the barriers that families were having, and then pulled in key stakeholders, and what an amazing impact you've had with this project for children and families and the community. So thank you for sharing that with us today.
Well, thank you for having me.
Our pleasure. Next, we're going to hear from another guest, David Alexander, who is a research director for Illinois Action for Children. David leads a strong team that collects, maps, and analyzes critical data needed for developing effective public policy and programming for children and working parents. He has worked with program staff, outside researchers, and advocates on a number of research and advisory projects related to children and working families. He's here to share with us some of the ways the Illinois Action for Children, a child care resource and referral agency and member of Child Care Aware of America, has worked as a catalyst for child care for parents with non-traditional work schedules. Welcome, David.
Thank you, Sarah. I appreciate your invitation, and I like your new report. It's very nice. What I'm hoping to talk about today are 3 ways that our CCR&R, the Illinois Action for Children, which is the CCR&R for Chicago and suburban Cook County, 3 ways we've worked as a catalyst for improving access to child care and high-quality child care for parents with non-standard work schedules. We've been focusing on parents' work schedules for a long time. I think our first report was in 2006, this has been relatively easy in Illinois because Illinois is a state which has long recognized that it needs to support in the subsidy system the family, friend, and neighbor providers for parents who do work non-standard schedules. Now, I mentioned data in the title of this presentation, but I'm not going to talk about data that much. We use all kinds of data. Some are very formal, administrative data, survey data, focus group and interview data, and some are more informal. They're collected with in discussions with our staff. The first of the 3 initiatives that I want to talk about is the community connections model, which we developed in 2005. We were observing in those days that many 3- and 4-year-olds with Illinois child care assistance were in home-based child care, but not attending preschool programs in child care centers or in public schools. And they weren't because the parents were often working or sleeping after working nights and couldn't use the centers or the preschool programs that had standard operating hours. So our response to this was to design a program. It was a very ambitious program that would connect children in family child care homes to preschool programs. In our case, it would be the child care centers that the state of Illinois was opening for the state preschool program. So we advocated for policies and opportunities that were needed to implement the community connections model. We first developed a partnership between state preschools and community-based child care centers so that the centers could operate qualified state preschools. Then we helped develop an individual centers, half-day state-funded preschool programs in suburban Cook County. And we brought in credentialed teachers where often there had never been a credentialed teacher. These were in poorly resourced communities. We wanted home providers to see preschool not as a competitor, but as a partner. So we advocated that for the child care subsidy system to continue to pay home providers for a full day of child care, even when the child was away half day attending the preschool. And the partnership that we developed with child care homes allowed us to recruit children for the preschool program. The last link in this chain is that we provided transportation between the child care homes and the preschool, which, as many of you know, the transportation is a critical issue and a very expensive problem for community-based preschool. We also felt it was important to support the improvement of childcare in the childcare homes. I'll skip those details, but one of the things we did was to bring a preschool teacher into the home biweekly to talk about what the 3s and 4s were learning, to bring books and materials, and to discuss the development of infants and toddlers in the home. By the way, the state agencies and other CCR&Rs in Illinois were very supportive of this. One CCR&R developed its own model, which was a home visiting model for preschool teachers in child care homes. Okay. Another project that we developed was a report, 50 interviews with single Chicago mothers with non-traditional or non-standard work schedules, and this was in 2012. It's called Choices in the Real World, and it's on our website. This is a different kind of project. It's not a program for parents, but it was part of our responsibility as a CC and R&R to inform the public and stakeholders about supply and demand issues in our community. We already understood that family, friend, and neighbor home care is not going to disappear for parents with non-traditional work schedules. But many stakeholders in Illinois, in government agencies, and among our fellow advocates didn't understand this. They wondered why family, friend, and neighbor care needed support. Our 50 interviews helped inform them about parents' reliance on family, friend, and neighbor care. This is the kind of thing that every CC and R&R can do, is inform the public about things we know a lot about. What we found in the interviews were that many parents were under great stress from earning low wages and wages that changed from week to week, so that sometimes they were unable to pay their bills, and from the stress of changing work schedules weekly or even daily or at the last minute. But in this climate, mothers told us very personal stories about how they trusted and appreciated their family, friend, and neighbor providers. The providers were flexible in providing childcare despite the mother's unpredictable work schedules and sometimes not being able to pay for the childcare or pay on time in any case. The way we responded to these interviews as an organization was that we recommitted ourselves to following our advocacy path and our provider engagement path. We've been advocating for a more flexible subsidy program, the Illinois Child Care Assistance Program, and we've been engaging providers in their homes as much as our resources allow us to do. We bring resources, we bring books and materials with us. We bring trainings on supporting infant and toddler development, as in a play and learn series. We bring nutrition. We became a sponsor for the USDA's Child and Adult Care Food Program, specifically to provide food assistance to family, friend, and neighbor providers, all within the limits of our funding. Those are different stories, but that's the kind of thing we've been working on now for over 10 years. Okay. The third thing I'd like to talk about is a recent project, and this is not mentioned in the new report, but this comes from a new policy research brief which we have developed. We think about this as a deeper dive into the data on family, friend, and neighbor home care over the past 10 years. The context for this is that Illinois has developed new rules for family, friend, and neighbor providers that are paid under the Illinois Child Care Assistance Program. Federal and Illinois regulations, as many of you know, require that many family, friend, and neighbor providers complete health and safety trainings and submit to monitoring of their homes. In Illinois, the announcement of this in January 2017 started a 25% exit from of family, friend, and neighbor providers from the Child Care Assistance Program. And that's what that little chart on the right shows, that from the point on January 17, there were 8,000 family, friend, and neighbor providers, and a year later in January 2018, there were 6,000, and we've been holding pretty much steady since then. The policy research question for us was, can the new regulations and the new staff needed to monitor, to train and to monitor, can these be opportunities to work more closely and in a better way with family, friend, and neighbor providers? Can we improve the care and not chase them from the child care assistance program? Can the data tell us anything? We have data over 7 years of 60,000 family, friend, and neighbor providers in Cook County alone. And we've analyzed, or we reanalyzed those administrative data. And the next couple of slides show some of the findings. These findings in our new policy research brief on family, friend, and neighbor care. In this first chart, on this slide, the chart on the left, chart 1, shows that over the period of 7 years, relatively few family, friend, and neighbor providers stayed long in the subsidy program. So if you look at the chart 1, the length of the participation periods, on the left side, the green and the purple on the left are the providers who stayed more than 1 year in the child care assistance program in Illinois. That's only 35% of all of those 60,000 providers. The rest stayed, you can see the various periods of time. For us, it raised the question, would it be, for which of these providers would it be the most wise to invest in training? Should we target some rather than others? Also, perhaps we shouldn't require extensive training until a provider actually has participated in the subsidy program for 7 months or 12 months now? Or should we begin all of our training of everyone with small steps just to keep people moving rather than to make them face a long series of trainings that are required by the state? Chart 2 on the right shows a different picture, however. Chart 2 on the left shows all the providers, family, friend, and neighbor providers in Illinois child care assistance over a period of 7 years. The chart on the right takes 1 month. And we went back a couple of years and we looked at how long the providers who were active during that month, October 2014, remained active for more than a year and more than 2 years. As you can see at the top, the purple is more than half of those providers who were active remained active for 2 years or more, and another quarter were active for about 1 year. This suggests that good training has the potential to make a real impact on providers who can have a real impact on the children in their care. The next slide shows some more data. We found, and we've known this for a long time, but in re-examining all of our data, we reaffirmed that there's a very large diversity of family, friend, and neighbor providers in their age, in their interest in providing care, in their career interests, in the ages of children, in the schedules of their care, and these are just some examples. If you look at chart 1 shows the ages of the family, friend, and neighbor providers. This was during 1 month that we selected. And as you can see, there's a cluster of providers who are in the 50, 59 years old age group, and then there's another cluster on the left in the 18 to 29%. 18 to 29 years old. For us, this raises the question, are these providers alike? Should we expect them to have the same interest and to respond the same to trainings? Or should we have a more flexible training system that targets or addresses providers in different ways? If you put this together with chart 3 at the bottom, you can see, and this chart shows the percentage of providers in each age group that completed the trainings. This was partway through the training period, when providers had to get trained. And we were interested in how they were progressing. And as you can see, that the providers under 30, very few of them had completed health and safety trainings, while the providers, the older providers, were completing them, still not at a large rate, only about a quarter, but at a much greater rate than the younger providers at that time. This, raises the question for us: should our trainings be doing something different for the younger providers, or should we be doing more for the older providers to get them to participate at greater rates? Those are the kinds of questions we still have, and we're looking more deeply, and we're surveying to try to get a better sense of these issues. The last chart on the right is probably the one I should have put at the beginning. This is the percentage, the gold bars, the percentage of family, friend, and neighbor providers who work at least one non-standard hour by the shift. You can see 72% of family, friend, and neighbor providers work some non-standard hours. So that's and in the evening, the majority work in the evenings, then weekends, and then overnight. About 20% work overnight. One thing I left off this chart is early morning hours, and I think even the number of family, friend, and neighbor providers who work early morning hours are even larger than those who work evening hours. So one of the questions there is, if we're monitoring, what does this mean that providers, family, friend, and neighbor providers are working all around the clock? What does that mean for scheduling, hiring staff to monitor family, friend, and neighbor homes? So those raise some questions, but I'll stop. I'll just draw one conclusion that this kind of diversity shows for us is that we believe that program staff need more flexibility. We would like to give them flexibility to engage providers in their own terms, to build relationships, to gauge providers' career interests or lack of them, to recommend particular trainings or a series of trainings to providers, and to offer small steps for improving quality rather than to embark on a long and possibly ponderous training period. That's all I have to say.
Thanks so much, David. We're really pleased that we could take a closer look at some of that data you've been analyzing and thinking about not just the questions that you've been pondering, which might be similar in other parts of the country as well, but also those conclusions of the need for that flexibility and training and how we can best support family, friend, and neighbor care. So thank you for sharing that. I do want to just remind you, if you do have questions for Julie or for David, we welcome you to type those into our chat box. We're going to spend the next few minutes thinking about the child care resource and referral landscape and some policy recommendations. So presenting for us will be Jen Bump, who is a senior advisor at Child Care Aware of America. She serves as an organizational strategist supporting policy, research, and program initiatives. Jen has nearly 20 years of experience working with child care resource and referral agencies at the local, state, and national levels. So Jen, we'll turn it over to you.
Great. Thanks so much, Sarah. I also want to thank David and the team at Action for Children for really serving as a model for CCR&Rs around the country. We know that there isn't a single bullet to address these challenges, but clearly Action for Children has been innovative and their approaches have been data-driven. They've had a commitment to advocacy for children, and I think really do serve as an example for the rest of the nation to follow. So again, thanks so much, David, for sharing your expertise with us today. Child Care Aware of America, as many of you know and have experienced, is a champion for CCR&Rs around the country. In 2017, we launched the Ignite initiative. This initiative was designed to inspire, empower, and ignite the CCR&R field to evaluate and reinvent itself by evolving and elevating the relevance of CCR&R services. So naturally, our goal was to present the CCR&R system to key audiences like government officials and funders as an appealing, flexible, and capable service delivery infrastructure. So towards this end, our first step was to interview state CCR&R networks and government officials from all 50 states, and to survey 100% of local CCR&Rs around the country. The response to this study was tremendous, and I want to personally thank all of you on the phone today who contributed. It's such valuable information and allows us to do our job of being your champion. So what did we find in the data? Well, first, we found that CCR&Rs exist in 47 states in the nation. So we've got some really great coverage around the map. We also found that the vast majority of CCR&Rs are actively engaged in all of the traditional core CCR&R service delivery areas. So what do we mean by that? We mean services to families, services to providers, and services for communities. Next slide. So our interviews and surveys were really intended to capture baseline data about CCR&Rs and how they operate in those three core service areas, and to dig deeper to learn what CCR&Rs are doing to address some of today's most relevant and pressing issues, including how they're addressing challenges families face securing high quality care during non-standard hours. So our results show that CCR&Rs offer a variety of strategies that can lead to positive outcomes in this area. I think David's presentation was a good demonstration of that. And here are a few examples of what we found in the data. 8 out of every 10 CCR&Rs deliver technical assistance to family, friend, and neighbor providers. As we know, David mentioned, and Dion, these caregivers are most often the ones caring for children during non-standard hours. 70% of CCR&Rs use their data to better understand and monitor where and when childcare is needed most. And in the old days, we simply referred to this as using supply and demand data. But recently, we've gained some better understanding and traction on this issue by using the term childcare deserts. I'm guessing most of you have now heard that. You've heard people in the media, in the government use that term. So let's stick with it. It's working. But I think from an R&R community, we know that CCR&Rs have been working to address childcare deserts in most states for over 50 years. So this isn't new stuff to us. In fact, we were not surprised to find that 54% of CCR&Rs employ strategies intended to increase the supply of non-standard hour care specifically. And finally, we found that 31%, or 1 in 3 R&Rs, currently conduct enhanced referrals for families who need non-standard hour care. So as many of you know, enhanced referrals consist of the CCR&R calling childcare providers to confirm vacancies before providing the referral to the family, as well as offering ongoing consultation and follow-up with the family before and after the childcare search. And so you may be wondering, well, that's a great service, but why aren't more CCR&Rs doing this? Well, essentially, this is a cost issue. This is not a surprise to many of you directors out there. Most CCR&Rs just don't have the funding or the bandwidth to offer the service for non-standard hours at this time. Next slide. So this brings us to our recommendations for funders, and more specifically, recommendations primarily for state CCDF administrators, those charged with implementing the Child Care and Development Block Grant in each state. So we've outlined several recommendations about how to leverage R&Rs in our new report. And so here are just a few examples. Many of these are strategies that CCR&Rs themselves have identified as ways they can be better leveraged. And I know several of you are on the phone today, so I want to thank you for your insights. I want to thank you for being here today, and you've done a great job to inform these recommendations. So first, we're calling on state CCDF administrators to make data collection a priority. CCR&Rs are already doing this. I think David, again, was a great example of what the R&R Chicago is doing. Oftentimes, this happens at the local level and also through the state CCR&R network. The data can be used to better understand changes in the landscape and to understand what strategies are actually working. We also know that R&Rs are active in their communities as problem solvers. So we urge state administrators to bring R&Rs to the table for planning and policy development. Often R&Rs, as you guys know, are able to spot pitfalls or opportunities for success in ways that no one else can. Next, CCR&Rs around the country are working with the public and private sectors to make quality, affordable childcare available for all families. We're calling on state administrators to embrace R&Rs for their ability to facilitate these relationships. CCR&Rs are often said to be the best kept secret. You guys all know this. This is true when it comes to understanding how R&Rs are helping families. While some states are moving towards website-based childcare searches only, we know within the R&R community that only a CCR&R referral specialist can work with families in real time to help them identify creative solutions for families. For those families, that service is priceless. We also know that childcare offered in the evening or overnight brings considerations for families that are different than for childcare offered during the day. So this is where CCR&Rs can help. They understand and can share with families the applicable regulations for overnight care and give those families guidance on what to look for and what to ask for when searching for evening and overnight care. We know this is no surprise to you guys, but we're really calling that out for funders to make sure that they're aware of what you're doing and what you can do. And finally, we make several recommendations about investing in CCR&Rs to improve the quality and continuity of non-standard hour care. Next slide. So we know policy plays an important role in influencing the day-to-day realities of families and children. We conclude our report with several state and federal policy recommendations. At the federal level, Child Care of America is working on a daily basis to gain support for legislation and funding for vital CCR&R services, including the Child Care and Development Block Grant, the Child Care for Working Families Act, the Children's First Act of 2017. Our team is also working closely with lawmakers who want to introduce new legislation, and we always make CCR&Rs a priority when suggesting problem-solving strategies. Finally, our report makes several recommendations for state and local policy improvements. In addition to investing in state CCR&R networks and local CCR&Rs, we're calling on lawmakers to consider prioritizing non-standard hours in their tiered reimbursement systems and to consider mandating employers to implement secure scheduling practices for their employees. And there's several examples of those policies within our report. We're now going to move on to our next speaker to offer some specific actions that you can take to move the agenda forward. But I just last want to remind you that many state administrators may not be receiving Child Care Aware of America reports directly, including this one that highlights your role and your capabilities as CCR&Rs. So be sure to pass this along. Thank you so much.
Thanks so much, Jen. There's a lot to think about. And here to help us think about specific actions that we can take is Lauren Robertson, Digital Advocacy Manager at Child Care Aware of America. So Lauren, take it away.
Thank you so much. Hi everyone. I am just going to quickly go over some ways to take action with this report. I know Jen has alluded to a lot of different things, so I'd love to make sure you can take this report and go out into the world. So if you know a family or a family who has struggled to find childcare during non-standard hours, or a provider who provides care during non-standard hours, we encourage you to encourage them to share their stories. The more stories we have, the more leverage we have to make policy change and inform policymakers about this issue. We also encourage you to contact your local, state, and federal elected officials and share this report with them and ask them what they will do to build childcare supply and support working families. We also have an awesome social media toolkit with some beautiful images to share this report. with your communities, especially the business community who are making scheduling and employment assistance for those working families we talk about so much. We also created a handy one-pager with quick, easy ways to take action on non-standard hour childcare. No matter how much time you have, we encourage you to share that and to utilize it as well. And finally, we encourage you to join the childcare work movement for quality, affordable childcare. We encourage you to sign up and take the pledge, and you will receive action alerts from us at the federal level for quick, easy ways to take action for childcare. Now I'm going to pass it over to Dr. Dobbin, and she will be talking about upcoming projects the research team is putting together.
Great. Yeah, you don't have to put my picture in. So we just wanted to share with you what's on the agenda for the research team, some of the things that are coming up, and the exciting materials that we'll be sharing with you in the near future. Coming up very shortly, hopefully in early spring, late winter, we will be wrapping up our Mapping the Gap first kind of iteration of that work that we've been doing. We will be doing it with 3 new state story maps and a new report where we look back at the work that we did in 2016 where we identified what states were doing around supply and demand, and we revisited some of those places and some of those people and talked with them about what they did with their maps or what they did with their data and how they used it to either affect change or to create slots. So we're really excited to share those stories, because when we share how people are doing the work across the country, we often would hear, so what happened? So we're excited to be able to say what happened with some of those states. In the spring also, we'll be updating our millennial map, and I think this year we're having a bigger focus on students and infants and toddlers. Throughout 2019, we'll be working with Jen Bump and some of the research team to share more of the deep dives around what we've learned from CCR&Rs from the Ignite project. And so you'll see it in different products. In every report, we try to make sure we're including some of that data, but also we'll have some blogs, we'll have some different papers that are coming out that highlights a lot of the information and a lot of the work that CCR&Rs are doing throughout the country on different topics. In the summer, we'll have our state fact sheets, and in the fall, we'll have our cost of childcare report. Throughout the year, we'll be doing blogs. We'll have maybe a couple of one-offs where we're addressing a need addressing a topic that has kind of risen to the top. We will often do quick and dirty maps for folks, and you might see some of those come up as well. But we're really excited for the next year and look forward to working with you and sharing resources throughout the year.
Great, thank you so much, Dion. So as we look at wrapping up our time together today, we realize that there is little time for addressing your questions. So please do feel free to chat those into the chat box, and we'll make note of them, and we're happy to follow up on those with you. You also are welcome to email us at learnmore@usa.childcareaware.org, and we'll be sure to respond to your email and provide the information that you're looking for. We want to express appreciation for all of our speakers who presented information with us today. We're so grateful for your time and for your sharing. We want to thank all of you for joining us and for discussing the need for non-standard hours in childcare. Please do watch your inbox for some follow-up information where we're happy to share with you some important links and more information about some of the resources that we talked about today as well. Thank you all for your time, and we look forward to connecting with you again at our next member webinar.